Hi guys, it's me, Dr. Nasir, back again in Let's Crack OET together. First of all, thank you for so much support. We are close to hitting 19,000 subscribers in past 10 months. Today's video, as you have seen on the title, is on how to write the OET transfer letter. This video is very important. If you want to clear your OET writing, make sure to watch this video till the end. In this video, I will let you know of how to read the case notes, how to select the case notes, and how to write the OET letter and gain above 400 marks very easily. If you follow all these things that I will let you know in this video, you can get 400 very easily in your OET writing. So, before starting the video, make sure to like and subscribe to the channel and press that bell notification. If you have any questions related to this video, you can comment down below. And yes, make sure to share this video with your friends so they can also clear their OET writing. If you want your letters to be corrected, or if you want to join the reading only course, you can visit the website drnasiracademy.com and join it from there. Or you can contact me personally down on the number given in the description and shown on the screen. So, without wasting any time, let's get started. So, as you can see the case notes in OET writing, you will be given 45 minutes to write a letter, in which 5 minutes will be for the reading time and 40 minutes will be for the writing time. In 5 minutes of reading time, you cannot highlight, or you can only read your case notes. You cannot highlight anything. While during the 40 minutes of writing time, you can highlight whatever you want and you can select the case notes and you can write your OET letter. In this video, I will also let you know about the mistakes that usually students make and that hinders their score below 300. So, as you can see on the screen, the case notes say, Miss Tracy Ryan, a female patient shifted to the post-anesthesia care unit of James Cook University Hospital, Martin Road, Middlesbrough, TS4 3BW, UK. So this is the address. After having abdominal exploration surgery, so she had underwent abdominal exploration surgery. You are the PACU nurse. Read the following case notes and then complete the writing task. So what comes in your mind is that this female patient underwent abdominal exploration surgery. So now let's select the case note, then how the case note can be selected wisely. So if you can see on the screen, patient information is Tracy Ryan. You saw the date of birth, it is 21/02/1958. So she is above 18 years of age. So you will use the title with her last name. So it will become Miss Ryan. The first time you will use the name will be the complete name, Miss Tracy Ryan, while the second time you will use the name will be Miss Ryan. Don't worry, watch this video till the end. I will show how the complete letter is written. So, marital status is married, 2 daughters, next of kin, husband, 50-year-old engineer. Family history, mother has rheumatoid arthritis, father has hypertension and moderate aortic stenosis. Okay, are they related to abdominal exploration surgery? No, but you can still add this in the family history. Social history, secretary in marketing company, no drinking or smoking. Medical history is not significant. Surgical history, appendectomy 3 years ago and 2 cesarean deliveries. So this is very important. Appendectomy related to the abdominal exploration surgery and 2 cesarean deliveries. This thing is also very important. Admission date is 29/2021. Diagnosis, adhesive intestinal obstruction. Surgery date is 21/09/2021. So now surgical events. So this thing is very important. Patient had abdominal exploration following clinical and radiological suspicion of intestinal obstruction. Received general anesthesia, ETT tube and positive pressure ventilation. Very important thing. Started laparoscopically but shifted to open due to uncontrolled bleeding. Another important thing. You cannot miss these things. Lost a lot of blood, so received 2 units of packed red cell and 1 unit of plasma. any kind of transfusion history due to any reason is very important. Incision closed with staples, this is not important, but still you can mention it. So, if you can see after it, patient PACU nursing notes after patient arrived. Vitally, she was stable, BP 125/66, heart rate 89 and SpO2 98. So no need to mention all these things separately. You can only write, well, the patient when received was vitally stable or his vital signs were unremarkable. Okay, in order to effectively summarize that what you are writing. Administered 1000 ml Ringer solution IV. Upon waking, complaint of little pain, doctor ordered 1000 mg paracetamol and IV and ketorolac ampule intramuscular. You can write this, pain management. Okay, stayed in PACU for 1 hour following surgery. Following fully conscious, talking will be transferred to the general surgery ward. This is very important. Patient has urinary catheter attached to the urinary bag, central venous catheter for the administration of drugs and fluids, 2 drains from abdomen attached to the collecting bags. So any kind of attachment is very important. So now, nursing instructions. Monitor patient vital signs, report to doctor if any hypotension or tachycardia or fever. Keep incision dry and sterilized, important. All the things in the nursing instruction, you cannot miss any one of them. You have to elaborate each single thing in your writing task. So what is your writing task? Using the information in the case notes above, write a transfer letter to the general surgery ward resident nurse, Miss Daisy Anderson, summarizing surgery notes and post-operative nursing instructions. So this is your task, to summarize the notes and post-operative nursing instructions. So they can take over the case. Means they can further monitor and observe the patient. So this is how you should read the case notes very, very, very carefully. So now, let's go to the screen and start off with writing the letter. Before that, if you want a discount on my premium course, you can contact me down on the number given in the description. Make sure to share the link of this video so you can avail the discount. So, first we will start with the recipient address. Recipient address was Miss Daisy Anderson, General Surgery Ward, Residential Nurse, James Cook University Hospital, Marken Road, Middlesbrough, TS43BW, United Kingdom. So you mentioned the recipient address completely. Notice one thing, the starting alphabet of each single of the recipient address is capitalized. Make sure to not write any of the first alphabet in the recipient address in the lowercase letter or you will lose marks. After that, we will move on to the date. Write the date professionally as September 21st, 2021, or you can use the exam day date. Now, let's move on to the opening salutation. Dear Miss Anderson, remember the first time we used the name was the complete name, the second time we used the name was the first title and the last name. Now we will move on to the regarding section. Miss Tracy Ryan, always add the title in the regarding section, Miss Tracy Ryan, comma, date of birth 21st February 1958. Now, we will move on to the most important things in the OET letter, that is the body paragraphs, the introduction and the body paragraph. Make sure to convey the information in a logical manner in order to gain more marks. Not to make the fragmented sentence mistake, not to make the article mistake, not to make the verb mistake. If you control these type of mistakes along with the capitalization mistakes and the clarity mistakes, believe me, gaining 400 in OET writing is not that difficult. So if we start off by writing the introduction, so we remembered that she underwent abdominal exploration surgery. Her diagnosis was adhesive intestinal obstruction, and you had to explain the nursing instructions so they can take over the case further. what are the three important things that must be present in the introduction in order to you to gain complete marks? Number first, the name, the diagnosis, and the purpose. These three things, no matter you are a doctor or you are a nurse, they must be present in your OET writing introduction in order to gain complete marks. If none of them is missing, if any of them is missing, you will lose marks. So let's start to write the introduction. I use very simple words to write the introduction, like I am writing this letter to transfer. I am writing this letter to transfer Miss Tracy Ryan, who underwent abdominal exploration surgery for the diagnosis of adhesive intestinal obstruction. She has been stabilized and is scheduled to be transferred to the general surgery ward for further observation and treatment. So, we covered the name, we covered the diagnosis, and we also covered the purpose. Now, below it, you can also write the past medical and the family history. It is perfectly fine in the transfer letter, even though it is in the same hospital, but you have to mention it because it is shifting from a different ICU setting to a ward setting. So the ward nurse needs to know that her past medical and surgical history. So you can simply write it as Miss Ryan is married and has 2 daughters. You can write she underwent appendectomy 3 years ago and also 2 cesarean deliveries. So once you have written all of these things, now you can move on to what happened to her in the hospital. So if you start off writing the main body paragraph, you can write it as Miss Ryan was admitted the day before due to clinical and radiological suspicion of intestinal obstruction. So she was admitted 2 days ago. Today, during surgery, she was initiated laparoscopically but had to be shifted to open surgery due to uncontrolled bleeding. See how coherent the presentation of information is. She received 2 units of packed red cell and 1 unit of plasma intraoperatively. In the post-anesthesia care unit, her vital signs stabilized, and she was prescribed 1000 ml of Ringer solution. Why did I put a comma? Because the clause was changing. Now, the connector word. Additionally, she was administered 1000 mg of paracetamol IV and 1 ampule of ketorolac intramuscular for pain management. As she was fully conscious, it was recommended that she should be transferred to your ward with a urinary catheter, a central venous catheter, and 2 surgical drains. Now we explain everything that happened to her under your care. Now you will elaborate the instructions. In view of the above, kindly monitor Miss Ryan's vital sign and drains regularly and calculate her urine output every 12 hours. She should receive IV Ringer solution at a rate of 10 ml per kg slowly over 24 hours and ceftriaxone 500 mg every 12 hours IV. Please encourage her to wear compression stocking continuously. Ensure the surgical site and central line are sterilized and kept dry. Stop this video, go back to the part of the case notes and also write this letter as I am writing, and then see and correlate all the things with the case notes and see how coherently the information has been conveyed with minimal mistakes. Ensure the surgical site and central line are sterilized and kept dry. If any unusual symptom occur, kindly report them to the doctor. Now you will leave one line, you will write, if you have any queries, please do not hesitate to contact me. Now you will put the closing salutation, yours sincerely, PACU Residential Nurse. And boom, that is it. You have written the OET transfer letter. Make sure to pause this video, see the case note, write your own letter, and then try to compare it with my written letter and see that where you are lacking. Are you lacking in the introduction? Are you lacking in the grammatical mistakes like the verb mistakes, the capitalization mistakes, or any other kind of mistakes? If you have any questions, you can comment down below. And that was it for today, guys. Bye bye until the next video.